Good morning, everyone. I'm Karen Hiller, and I'm the chair of the city's Social Service Grant Committee. We are meeting on the morning of September 17th, 2021, with a special focused meeting on outcomes with some training from United Way. The idea being that it would be good for the committee to have that experience and at least a framework of a deep dive in training of the logic model and outcomes, and also for our senior city staff that are involved in this, and either a refresher or first time for our social service agencies. So with that, let's get the committee introduced, if you would.
Christina Valdivia Alcala, District 2.
And Tony Emerson, representing District 4.
All right. And we have with us today, we're missing our core social service staff from the city. Rochelle Vega-Retana is here, city manager's here, chief of staff Cochran is here. There was some discussion that planning director Finder might be on this call as well. We'll see. There he is. I heard him. Thank you, Bill.
Thank you.
Let's go ahead as a committee and approve our August 11 minutes, and then we'll go into our program. I would entertain a motion.
Move approval.
Second.
Moved and seconded to approve the Social Service Grants August 11th committee minutes. Any discussion? All in favor say aye.
Aye.
Opposed, same sign. All right, minutes are approved. With that, I will hand the baton over to Brett Martin from United Way. And you can do any introductions you need to, and thank you so much for putting this presentation together.
Thank you, Chair. A couple of introductions United Way-wise. So we have Juliet McDiffett, Director of Community Impact on virtually, and also our President and CEO, Jessica Lenhare. So my boss is on, so we'll see how I do today.
Okay.
Is it okay if I unmask? Are we good with me doing that? Okay, thanks. Okay, so today what we wanted to talk about is we want to talk about outcomes. And I realized as I was putting the presentation together that if we just talk about outcomes, we're kind of missing why outcomes are important. So what I thought I would do is, for many of you, this is going to be a review. For some, it may be new. For some, it may be some different language than you've seen before. But what I thought we'd talk about is essentially what a logic model is. And so a logic model is going to be the focus today, but we're going to get to outcomes. And hopefully by the time we get there you have a pretty good sense of what this logic model is and why these outcomes are important, and why this committee in particular, investing the dollars that they're investing, want to ensure that there is a solid logic model and a solid set of outcomes in place in order to make sure that those dollars are invested in doing what they're intended to do. So this is what we're going to talk about today. The aspirational statement from United Way. We'll talk about what a logic model is. We'll talk about how to write a good goal statement. We'll talk about inputs, what inputs are. We'll talk about activities, what activities are. We'll talk about how much a program will do. Those are called outputs. And then we're going to talk about how well a program is proposing to do those things. And those are the outcomes. So we're going to get to the outcomes at the end, but honestly, we can't talk about outcomes just separate from everything else. So I think you'll see as we move through why taking a look at a logic model is important. So just why we do this at United Way, why it's important for us is we believe in our community that until the fight is won, fight against things like poverty, fights for education, fights for equity in our community. Until that's done, we're going to be creating and cultivating an unbreakable network of support for a strong, healthy, and equitable community. Again, that's our polar star. That's what we're doing. That's why I'm standing up here today, and that's why we're the vendor for these grants. So what's a logic model? We're going to talk about what a logic model is and then why that's important for us to do this. So a logic model is a way to take program components, all the various components of a program that you are proposing in your applications, and describing how all of those different pieces combine into a function, ultimately, that's going to get you to some results. Any funder, whether it's a municipality, whether it's a private foundation, whether it's United Way, whether it's individual donors themselves, whether it's HUD, people want results. And so in order to be able to get to those results, programs have to be planned out carefully, and you have to think through exactly what goes into place in order to be able to get there. That's why I didn't want to just talk about outcomes today, just for the sake of outcomes. I want to talk about how we get there. And so a logic model is going to be a way to do that. So logic models. I'm going to walk through a logic model, give you very specific examples of what logic models are, but logic models can be used in all kinds of different ways and can be used for various purposes. It can be used, to build consensus among different parties. It can be used to communicate, and that's what you're doing in an application, is you're communicating to, for example, an individual who's scoring an application, or maybe a grant panel, what you intend to do. Logic models can also be helpful in these latter two areas, which I think are most important for us today: program planning and program evaluation. So when you're planning a program, this is going to be a really great way for some of you to think back through your programs. Many of you do this, your old hat. Some of you could stand right up here and do this right alongside me, probably better. But for some of you, maybe you haven't thought about planning your programs this way and evaluating your programs internally this way. So that's another way that a logic model can be helpful. So it starts with a goal. It starts with a goal, a stated goal. And then that goal is going to be related to the inputs. We'll talk about what inputs are. Then those inputs are going to be used to carry out activities. That's what you're going to do in your program. And then those activities are going to lead to outputs, how much you do, and outcomes, how well you do it. So it starts with a goal, have to have a goal. Inputs, things you put into it. Activities, the things you do. And outputs and outcomes are the results. So let's talk about these. A goal statement. A goal statement. Any good program that is seeking application for a social services grant, for a United Way grant, for a Topeka Community Foundation grant, for a Kansas Health Foundation grant, for any grant, should have a goal statement. People want to know what you are going to do, and it should be a fairly broad vision of what you hope to achieve through your program. But it's got some different components to it. So it's got to have an action verb, right? People want action, people want results, people want ROI, return on investment. And in order to be able to put together a goal that demonstrates that from the very beginning, there's got to be some action. So it needs to be increase, improve, demonstrate, expand, something like that. None of us is going to propose a program that isn't going to change anyone's life. If you do that, you're likely not going to get dollars from anybody. Nobody wants to invest. People want to know that you are going to carry out a program in a way that when people get on the other side of it, something's happened. There's been action. There's been results. Somebody's better off. Then you need to tell us who that population is. For some of you, it's seniors. For some of you, it's people who are food insecure. For other people, it's people who are housing insecure. For some, it's youth. For some, it's folks who present with behavioral health concerns. Any of those types of things. There needs to be an action verb. There needs to be a specific who you're impacting, and what you're carrying out. Okay? So an action verb, a specific who, and a specific what. You can advance slide. Then there needs to be some measure of time. There needs to be some measure of time. That can be 6 months, that can be 12 months, that can be 2 years. It could also be after, if you want it to be a little more vague. But people need to know when you're going to carry this out, you have a limited period of time where you believe that once you implement your program, once you get to this period in time, you will have achieved X results. And so there needs to be some type of measure of time here. Then there needs to be an intended result or outcome. Maybe you want to say that for this particular people, we are going to increase food insecurity over this period of time so that this many people are more food secure. Or maybe this number of people are connected to resources. Or this number of people receive transportation. Or this number of people have been referred and connected to services. So there needs to be a measure of time. How long is it going to take me to do it? And there's got to be an outcome. And that's all in your goals so that you understand from that goal how it is that you're going to build the rest of this logic model and how it is that you're going to carry out your work. So that's the goal. That's the goal. Now the inputs. The inputs are all those resources that are necessary to achieve your goal. And they can look like a lot of different things. They're definitely going to have human resources. For so many of the programs in our community, the people are the program. We say that over and over again. We say that at United Way when folks take a look at the numbers and they say, wow, we're investing a lot in admin. We say, that's not admin, that's the program. The people are actually carrying this out. And so those are going to be your human resources. It's going to be the leadership in your organization that's supporting it. It's going to be the staff or personnel who are actually going to be carrying it out. For many of you, it's volunteers. A lot of you rely heavily on volunteers, and so there are going to be volunteers that are there. It could also be collaborations that you're a part of, those collaborative groups that you might find yourselves a part of, where you might do information sharing, where you might share expertise, where you might problem solve. Those are all human resources that come to bear, and those are all inputs. And they need to be related to the program you're talking about, right? So you don't want to necessarily include human resources that are part of your big agency that don't have to do with this specific program. So everything we're going to talk about today with this logic model needs to be specific to the program you are proposing that you're carrying out in this particular application.
Brett?
Yeah, absolutely.
I'm sorry, I hate to interrupt, but do any of you guys need to come up to the table where he can write easier? Okay. Sorry, I just see people kind of...
Sure. No, absolutely.
Okay. You're welcome to if anybody needs to come up here, because it looks like this is really a lot for you guys. So,
sure.
Anyway.
Thank you.
Sure.
So the second piece of resources are financial resources. That's the money. And that money can look like a lot of different things. It can look like the grant you're hoping to secure. It could be fees for service. It could be reimbursements that you're getting. It could be donations that you get as an agency that you have earmarked for this particular program. Those are all the financial resources that come to bear. So you've got human resources that are inputs, all the people, and then you've got the dollars, the way that those come in. Material resources. That's going to be the stuff you use to carry out your program. So this could be a software system, for example, that you use to track data and to track client outcomes. It could be a warehouse that you use, or a physical space that you have, or a particular community center or something like that where your work is carried out. It could be vehicles that you use in order to be able to do this. But again, this needs to be specific to the program you're proposing. So for example, if you have vehicles for food distribution and a warehouse where you keep all that food, and you are talking about serving youth and not distributing food, it shouldn't be a part of this particular application. This all needs to be really specific, really targeted, really laser focused. Because again, you want your reviewers to have the information they need to make a good decision. And if you're talking about a food warehouse that you have over here and talking about serving youth where you're not serving those youth food, it confuses your reviewers, and it also can give the sense that you're that you're even trying to overstate the inputs that you're bringing to this. But ultimately, what it means is that you're confusing folks, and it really doesn't have anything to do with what you're proposing in the program. And I only say that because in hindsight, having read some applications, some United Way applications and others, sometimes folks put a lot of inputs in here that don't have to do with the program. So it's really important that they are specific to the program itself. So those are our inputs. Those are all the things we bring into this program in order to be able to carry out these things. These are our activities. This is what your program is going to do. So let's talk about what those activities look like. They're going to answer some really basic questions. What's the basic description of your service? Is it food delivery? Is it prescription vouchers? Is it housing vouchers? Is it transportation? Is it behavioral health services? Is it after-school programs for youth? Is it during school during school activities for youth? What is that basic description of your program, those things that you're going to do? And then in this, you need to include, again, you need to think back to those inputs and ask yourself the question, who's carrying it out? And what are their qualifications? That's an opportunity for you to showcase the expertise of your staff, but also be able to set yourself apart from other programs to be able to say, the individuals who are carrying out the activities in our program are uniquely positioned to be able to do this because they are trained and they have expertise in these ways. So what's the description? Who's doing it? What are their qualifications? Next slide. Who's the target population? Who are we trying to change here? That's what ultimately we're trying to do with all of these grants. We want change in the community in some type of way. And so who's that population that you're focusing on, where you're hoping to see some sort of behavioral change, material change, change in attitude, something like that. So who's the target population and what are their unique needs and barriers? This is where local data is so important. Oftentimes in grants, because it's just the way we do things, sometimes we pull national data because it's easy to find from the census or it's easy to find from our national association, and it doesn't really speak to the unique needs and barriers of people in Shawnee County or in the city of Topeka. And so this is where local data is really important, because you're essentially laying out your case here. Because your grant reviewers oftentimes are not experts in your particular field. So they don't know, for example, that seniors experience this, or that youth experience this, or that LMI families experience this. They don't know that. This is an opportunity for you to be able to lay out your case and to be able to explain what those unique needs and barriers in Topeka, Kansas in 2021 are for this particular population that you are hoping to move from A to B. The other question that it should answer is, what are the approaches? How are you going to do this? And how are these data-driven best practices? Right? This is where, for example, you can pull from your national associations and you can pull from national groups, because none of us in Topeka, Kansas, for example, has the money to be able to hire private firms to come in and to be able to measure our work and then to be able to develop best practices. We rely on other folks to be able to do that. This is where that's really important. But what are your approaches? There are going to be multiple people who are applying for the dollars you're applying for in the area you're applying. This is an opportunity for you to set yourself apart and say, this is how our approach is distinct from other approaches, how it's connected to data that actually says if you do this, it works, and it's been vetted by pilots and by other different entities across the United States or across the world or whatever that looks like, in order to be able to have that moniker best practice. So who's the target population? What are their needs locally? What are the approaches? How am I going to do this in a way that sets me apart? And how can I best demonstrate that if you invest in me and you invest in this program, you are going to get results because the data says X? And how are these activities and approaches addressing root causes? So if you can imagine for a moment, many of you have heard this type of metaphor or this story in any number of different ways. An individual is next to a stream and notices a baby floating down the stream and goes to the stream side and pulls the baby out and does that again. And every day, this individual comes to the stream and they see a baby and they work so hard pulling babies out of the stream. They get friends to come. Too many babies for me to pull here. They start getting other people together and they start organizing and they develop a program to pull babies out of the stream. Great, happy to pull babies out of the stream. However, we don't want to just pull babies out of the stream over and over and over again for generations. We want to ask some questions like, where are the babies coming from and who's putting them in the water, right? Those get us upstream to what we would call root causes. And so while oftentimes our programs are designed to really meet the symptoms of issues in our community, we actually want to get to the root causes of those issues, and it's important for you as you're putting together a program and a program proposal and an application, whether it's for City of Topeka, whether it's for any other foundation or group, to be able to explain how you're actually addressing root causes, right? Because folks, over and over again, while it feels good to pull the babies out of the water, it does. You feel like a hero, you feel like a champ. At some point, it exhausts everybody's resources and it doesn't actually take care of the real problem. We just continue to treat symptoms. So getting to root causes, hugely important, and you have an opportunity here in your grant application to be able to explain how the activities and the approaches of your program are actually getting there. So those are activities. Let's take a look at the next piece. So after activities, after our goal, big broad vision, we have our inputs. This is everything we're bringing to the table, and hopefully your money. Here are the activities. This is the way we're going to carry this out. This is how we're uniquely positioned. This is our expertise. This is how we're addressing root causes. This is how we are bringing experts and data to the table. Now this is the opportunity to explain what your program's actually going to do. Outputs are quantitative. It's numbers. It's numbers in terms of amounts. This is the amount of activity or amount of services that you're going to provide. They answer a really basic question. How much are you going to do? Okay? So what are some examples of outputs? Now, we're really good in our community at outputs. We do a really good job at outputs, and here's a bunch of examples. Number of people served, right? Number of services carried out. And that can be defined by your program in any different way. It can be defined as trips. It can be defined as vouchers. It can be defined as pounds of food. It can be defined as a clothing that is supplied. It can be any number of different things, counseling sessions, contacts, any number of different things like that. Outputs are also the number of volunteers you engage. Folks want to know when they're investing money that you're bringing things like volunteers to the table to help expand your capacity. So this is one place where we miss outputs sometimes when we talk about the number of volunteers engaged. We've got folks in our community who are using volunteers in a way where it's generating $250,000 to $500,000 of economic impact every year. And when we're not asking that question, we're really missing the larger picture of how much programs are actually doing. So volunteers engaged are actually an output that you can use to be able to demonstrate the impact and effect of your program. Number of collaborations or collaborative meetings. Those are outputs. Those are ways that you recognize that the issue that I'm addressing in my program is bigger than my agency, it's bigger than 2 agencies, it's bigger than any program, and we need more minds together to be able to come together for this. So, an output is the number of homeless task force meetings you've attended. That's an actual output for a program, and something that can be put out there. For example, I know we've got some folks who are part of the task force who are here. That's an actual output for your program. For your specific program, but again, let's think about this and remember that this is laser focused on your program. So if you have collaborative meetings that don't have to do with your program, that shouldn't be something that's included here. So for example, if you're part of Homeless Task Force, which has its goal of being able to provide shelter and housing for those who are unsheltered in our community, if you're talking about something that doesn't have to do with that, an output of HTF meetings wouldn't be a reasonable output for this, because again, it's going to confuse your reviewer and it's not actually focused on what you're talking about. Number of events. What are events? Those could be events where you're out in the community being able to share information regarding your agency or your program. Number of trainings offered. These could be trainings for your staff. These could be trainings for the community. These could be trainings for, trainings that you've provided to volunteers. It can be any number of different pieces like that. Number of advocacy events or opportunities. This is where you are advocating for the population you're serving, for there to be big system level change, or just to be getting the issue out in front of people in the community. Those are also opportunities for you to share outputs. So those are outputs. How much will your program do? Now, Not all of this, let me stop here and say, you're not going to have an opportunity to share all of this in an application. So the purpose here gets us back to a logic model in terms of helping us for program planning and program evaluation. You may just keep this information internal. Maybe it's shown to your board. Maybe it's shown to a particular body that you report to. But it is a way for you to demonstrate the breadth and depth of your program and help you think about how to plan it and how to evaluate it when you're looking at effectiveness at whatever milestones you have along the way. So, goal, broad vision, inputs, what we're bringing to the table, activities. This is what we're going to do. These are the people we bring to bear. This is how we're unique in carrying it out. And this is how we're addressing root causes. Outputs, how much we're going to do in any number of different those ways. This is the reason why we're all here today, is to talk about outcomes. This finally gets us to this last piece. But hopefully, in sharing a little bit about logic models, you have a sense of how we actually get to an outcome. Outcomes are that qualitative measure. So if outputs are quantitative, outcomes are qualitative. And they're going to measure the success of your program. And they answer the question, how well will the program do? For years at United Way, and I've said this before, for years at United Way, for decades at United Way, we granted dollars out, and all we could answer is how much programs we're doing. That was it. We could say this many meals served, this many senior trips, this many housing vouchers, this many youth served. We could never answer donors when they said, is anybody better off? That's the outcomes question. That's the hard question. That's the turn we started in 2008 to 2009. And that's where a number of your programs are now. And that's what national funders are looking for. That's what local funders, like the city of Topeka and municipalities, are looking for. How well will the program do? Because if no one's better off after the program, folks don't want to invest. Folks don't want to invest. And you know that they're better off, because you work with frontline staff who tell you stories all the time, and you know that lives are changed. We have to figure out how to do that in a qualitative way that matches an outcome. So let's talk about what outcomes can look like. And I've tried to pull together a pretty robust list here to have some examples for you of what outcomes look like. So notice that every one of these outcomes is measured in a percent and not a whole number. So if you're going to serve 1,000 people, an outcome is going to measure what percent of those folks have met whatever it is that you have here. So percent of clients or customers who were referred and access resources. So oftentimes people will put as an outcome the percent of people who were referred. So it's not everybody who comes through the door, but this percent of people who have come to the door have been referred for X. That's good. But a strong outcome actually goes that next step and says, how many actually accessed the resources, right? So it's not just the percent of referrals that you made of the total number of people who came through, but it's actually those who accessed resources, because when they access those resources, that's where change takes place. It's not just getting information to people, but it's actually having them access resources in a way that changes their particular station or where they are right now. Outcomes are all about change. The percent of clients or customers who graduate the program, right? You've got certain programs that you may have people go through, and the percent of those who graduate indicates some level of success, because those graduates who come through have met certain requirements. They have learned information. They have put it into practice. They have built relationships. Whatever that may be in terms of what the graduation requirements are for the program, the percent of those who have graduated from the program does equal some outcome, because there's a change that has taken place, provided that your program is effective. And you've at least laid the case out for that in your application. The percent of clients or customers who obtain household sustaining employment for 6 or more months. That's a change. You might say, for example, we trained people in soft skills in our program, and that's an output. It's great. We're really happy to hear that 75 people have been trained in soft skills or have been connected to resources for certificate programs. But what we really want to get to for a root cause and where we really want to see change is how many of those folks have obtained household sustaining employment for 6 or more months. Notice that this is time constrained in many ways, just like the goal was. The goal had a particular time frame on it. Outcomes can have a particular time frame here too. It's ways in which you're demonstrating to your potential grantor and to potential investors that we are saying that a reasonable expectation is that we can track folks for 6 months or 9 months or 12 months, depending upon what your program chooses, or 2 years, that we are able to measure and actually track for X period of time that people have obtained and sustained this level of employment, for example, if that's the way you're going. Percent of customers or clients who remain housed for 6 or more months. So we talk a lot about this when we talk about housing, particularly when we talk about rapid rehousing in our community and when we talk about actually sustainability for families. It's great to get someone in an apartment or in a house, but that's not the goal. The goal is to keep folks housed. So maybe you put 6 or more months in there. Maybe it's 9 months, maybe it's 12 months, maybe it's 24 months. Whatever it is for your program, that's an actual outcome. That's success. That's demonstrating change in the community. It's qualitative. It gets to this outcome piece. Again, it's more than just we gave out 20 housing vouchers. Well, of those 20 housing vouchers, what percent of those folks are still in a house? Because that's what we want to get to. That's what investors want to get to. That's what we as a community, when we're investing public dollars like this, for example, that's where we want to get. The percent of clients or customers who achieve positive health outcomes that you define for 6 or more months. So I can tell you from our panelists who reviewed the last set of applications, when you say you gave out a survey and you don't describe that survey, it makes this outcome really squishy. They say, well, what did the survey say? And is it reliable? Is it valid? Is it a tool that actually measures real change? Or is it just, how do you like the service? Are you happier? Right? So these particular positive outcomes, and in particular positive health outcomes, which may mean things like fewer mental health days, it may be fewer days of social isolation. It may be something like people demonstrating positive tests in certain ways, or maybe lower blood pressure, or fewer ER visits. Whatever that is, those positive health outcomes that you have clearly defined, that they have that for 6 or more months. Again, for whatever time period you choose as an organization. But that gives you a sense, and that gives a panelist, a grant reviewer, and your investor the sense that you know what you're doing and that you know that you're going to be able to hit this outcome with your particular population. Percent of clients or customers who reported improved mental health, again, based on a reliable and valid tool. So we had Heartland Healthy Neighborhoods Work Group, the Communities of Care, under Tim Swenson's leadership this last year, develop a tool on mental health for seniors. That's great. They were able to develop a reliable and valid tool that then they were able to use with seniors across the community to be able to get some baseline, and then to be able to have folks be a part of a program and then come back and take it again and demonstrate improvement, improve mental health based on a score or based on something like that with a tool. That's the type of piece that we're talking about here. Percent of clients who reported decline in social isolation related to receipt of transportation service. Again, based on a valid and reliable tool. So this, for example, for folks who are doing transportation and folks who happen to be isolated because they are in certain demographic or population groups, this is a way that you are able to demonstrate an outcome, a qualitative change in your population, not just number of trips, but actually that the trips, that the transportation service that provided created some measure of change with the population. of clients who report an overall improvement in health related to receipt of transportation to and from medical appointments. I've pulled a couple of these in particular very specific outcomes to give folks a sense, because sometimes when we are talking about transportation in particular, sometimes it's hard to be able to get to outcomes. And so these are two examples here of how transportation can be, its effectiveness and the qualitative change can be demonstrated in an outcome to let a certain group of people know, a grant panelist, an investor, or a quarterly report, whatever that is, that the transportation service that was actually provided changed somebody's life. And that's what we're talking about with all of this. The outcomes on the end. We would not be investing these dollars if everybody were healthy, if everyone had good mental health, if everyone was housed, if everyone was food secure, if families were safe from violence, if we were actually investing equitably in our communities across racial, ethnic, gender, etc. lines. If we were actually doing that, and if we actually had those types of outcomes, we would not be investing these dollars. But we are investing these dollars because we know we have issues with poverty and housing and equity and any number of different things, and food across our community. And so you have to demonstrate that the money you're going to get changes things. Grant reviewers and investors also know that that doesn't happen in 6 months, that it doesn't happen in 12 months, that it doesn't happen in 10 years, that sometimes it takes a generation. And so that's the tough piece with outcomes, is being able to demonstrate how your particular program in this corner of the world, in Topeka, Kansas, for this period of time, is going to be able to demonstrate change. But it's the world we live in. It's the way we have to do our work, because ultimately people want to know. People are no longer satisfied with just knowing, congratulations, you served 1,000 meals, or you had 50 medical trips, or you put out 100 housing vouchers. Folks aren't satisfied with that anymore, because honestly, since 1963-64, when we had the poverty rate developed in the United States, nothing's changed. We have not changed the poverty rate in any kind of substantial way in 2 to 3 generations in the United States. So we've got to have programs that are coming forward that are demonstrating that change, so that we know when we're putting our tax dollars in it, when we're putting our private dollars in it, when we're putting our federal dollars in it, that somebody's better off at the other side. And so that's where your outcomes can be the strongest part of your application. And everything builds to that. That's why it's at the end of the presentation. That's why it's at the end of the goals, the inputs, the activities, the outputs, because ultimately, this is where we want our community to be. We want to know that these programs have improved lives in these ways for these particular people. So those are outcomes. So there was a lot there. Goal, inputs, activities, outputs, outcomes. Lots of stuff there. I am certain that there are questions. Or maybe not, but I doubt it. And I don't know how we want to do fielding questions.
Let's get the attendees, the Zoom attendees on the screen so that we can see if they have a question.
They just don't have their cameras on, so they're not appearing, but there are people in here.
Well, they need to, I don't have access to the chat, so they need to put their mics on anyway and let us know if they want to speak then. And any of you can just raise your hands. I'll kind of get it going and point out that in the social service applications that we have at the city, what you'll notice is that we actually do a step prior to the goal. What Brent referenced in activities, we put right up front, and that's what's the need. Mm-hmm. And so describing that need up front in the way we use the logic model was, first you need to just tell us, you need to know why you're doing this. You need to be able to describe it, and then you set your goal or your outcome based on that need. And so one of the things that our reviewers and our grants do is ping that all the way down the line. Your need statement needs to match up with your choices of what your activities are going to be, what those outputs are, and it needs to match up with those outcomes. And so I think some of our grantees have struggled a little bit with that, but that's why we separated it, because that's where why are we here? I remember as a United Way director myself years ago when we were all struggling with this, learning this model, and the Girl Scouts of America put one out and they said, here's how to understand outcomes. It's so what? Just so what? Why are we doing this? And if you can't answer, so what? You know, why are we doing this? And then what did we get out of everything we're doing? And I always found that so helpful. We went through all these trainings, and that's what always stuck with me. But understand that we do pop those needs out into the very first section, which those of you who have done them remember, and others may as well. And that's why, just to be step by step through that.
Yeah, absolutely. Sometimes that will show up in the RFP as the situation. Sometimes it shows up there if it's particularly targeted. Sometimes the grantor sometimes has a lot of data in there demonstrating what that particular need is and what the situation is that they're trying to fix. And sometimes you define that. And in the city grants, you can help define that because it's not just housing, right? I mean, it's preventative services in some ways, but it's counseling support services in other ways. So sometimes folks will define that need and that particular situation. In the city grant piece, yeah, you're absolutely right. You need to be able to define that need for the grant reviewer in order for them to be able to follow, and it needs to follow through. It needs to be laser focused all the way through, goal clear to outcome.
Because maybe you define the need for your population,
Right.
and then you've picked out, like Brett says, what it is you're going to address. Are you going to address that whole person, or are you going to address, like, seniors are lonely, not healthy, not getting enough exercise, and not eating well, let's say. And nationally, the data shows that, and in Topeka, our data shows about the same thing, or, you know, something specific. And we're going to address all those, or we're going to address two of them, whatever. But that for me, it helps that, again, that's how we've set up our grants.
Right.
But it helps to focus and carry through that. So therefore, are they healthier? Are they eating better?
Right.
Are they are they happier?
Right.
And what is it we were trying to do?
Right.
Is that module available online on United Way? Can I get a copy of that?
Yeah, so I've got this whole piece, and this particular presentation is in a PDF that actually goes on. So Joyce just uploaded it yesterday, and she's going to hopefully get access to the link to this video and drop it in there as well, so that you have a PDF, you've got
Super.
the actual PowerPoint, and then you've got the video for those who weren't able to.
When you have so
Participate.
many different grants that you're doing, and
Absolutely.
so many different things, it's always
Right.
nice to have something,
Right.
hard copy of something to reference back.
Exactly, and to be able to, I mean, this is all pretty standard stuff
Yeah.
across the board. But if you can get to the end of your application and then go back and say, I answered that question, I answered that question, I answered that question, you're certainly stronger. And that's where this helps with program planning and evaluation in particular.
Tony?
Thank you, Chair. Brett, first of all, thank you for the presentation. I did have a question, though, and I really like what you said about addressing root causes. But in our process we use at the city, it doesn't seem to me like we take that into account, or do we? I remember you saying that some of you were surprised that something that you didn't maybe think yourselves was as worthy of a thing got awarded money because they were good at filling out reports.
Right.
They said we're going to serve 25 people, and they served 25 people.
Right.
But it wasn't necessarily, you weren't doing it, I guess, based on either, wasn't addressing a root cause. It was just based on percentages and outcomes and metrics.
Yeah.
Do we do that?
We don't have that specifically worded in the city grant application or in the score sheet. Not called out specifically. There is no way, and so you're absolutely right, that was some of the feedback we got from reviewers, was that they didn't feel like they had any way to be able to evaluate whether or not these approaches were getting to root causes, and sometimes they felt like they weren't even able to evaluate the quality of it in some ways. In other ways, it was called out specifically. But that would certainly be something to take a look at. It's something that we took a look at our applications over a period of time. We don't specifically call it out in our United Way applications with that particular language. It's a direction we're moving because we think ultimately, even if you're not, so for example, to use the chair's example, if you're serving a particular population, you are not expected in a grant application to be able to talk about how you're changing, 1,000 people's lives in a holistic way, necessarily, depending upon the nature of the grant. But most of the time you're not. But you need to be able to link how what you're doing is changing, is creating this change, which is linked to one of those root causes. In some way. But we don't call that out specifically in our application or score sheet for the city just yet. It's something to think about.
Well, I think his question was, if you've done a good job of describing the need, but maybe relationally to other needs, the committee or the city might not think that particular, it might fit in one of the categories, if I'm following what you're saying.
Yeah.
But it maybe isn't as important
Right.
as another one. We
Right.
don't have a way to rank that. So-
Karen?
Well, yes, Chair, that's partially right, but, Brett, as you said, the people taking the babies out of the water, there are some things that if you solve the root cause, it eliminates the need for 4 or 5 other programs, right, down that line. So if you're sitting there and you have one program you can fund for $100,000 that eliminates 10 programs that cost, $100,000 apiece,
Right.
or even if it's $500,000,
Right.
do we ever look at that, or do you guys ever look at that? Because I think that's a great point you made earlier about the root cause.
Yeah, we do. Another way to think about it is how are those 10 programs working together, right, and not in isolation from one another. So, in a community our size, we probably don't need 1,000 programs working on this one particular issue. However, if all of those programs were doing pieces of it and working together in a collaborative way to actually focus on a root cause, maybe, because we also recognize that programs through the power of collaboration, relationships, volunteers, and other types of things don't have to do everything themselves. And so, ultimately, I think where a number of us in the community would like to be is to be able to see how is it that a lot of these big intractable problems that we're working on in the community, how is it that our entire system is working together to alleviate some of those root causes. Some might be working with this population. Some might be working with this population. Some might have this approach. Some might have that approach. But ultimately, we can say in the city of Topeka, with this particular group of people we're talking about, we've got 10 programs who are all rowing in the same direction and who are all moving in that way. And they're not necessarily duplicating services. They're all just working together because it's a really hard problem.
Or you don't want just one daycare center.
Right?
You need a lot of daycare centers.
Or I say, not every social service agency needs to build an on-site clinic. Not every school needs to build an on-site clinic. You need to have relationships where you can actually do that. Not everybody needs a person who does advocacy at the government level. People can work with and collaborate and share stories and share resources to be able to share a position or to be able to utilize folks in that way. So not everybody has to work upstream, midstream, and downstream, but the relationship and the system should be moving that way.
Thank you.
Councilwoman?
Thank you, Chair. So then my question, do we have that system? Do you have that system set up where you know what's happening with all these agencies? Because for a population of less than 127,000, and I look at all the social service agencies, all the programming, I have some deep concern that there is duplication of services. I have a deep, deep concern that we need to get out of our silos, and we should be able to get out of our silos because, again, we are less than 127,000. In my mind, so many of these things should be done and can be done, but who's going to be the one to start that process? Because we know that throwing dollars at something through old models right, are not working. And I will say I was very impressed with this because not having the expertise in this was tight, this was compact. And my suggestion would be for us as a grant committee going forward and continuing to work with y'all is that we need to not only know that there's going to be this one presentation here, which is very good, and we'll all have hard copies to take home or to take to our agencies, and that there may also be training, that you give every year. But I still believe that we should have something written in to the application itself that is very deliberate about, what we're saying here about what is the need, and what are you doing to meet the need? I mean, to get down so base into the verbiage of it that newbies coming on board, maybe a position has shifted and the old grant writer is gone and didn't have any time to train the new grant writer, and they'll be able to look at the city application and it will be very succinct and to the point.
Right.
With the verbiage that is needed, that is understandable, because sometimes it can be, it can be overwhelming for new folks coming into it.
Absolutely. I will also say this. I will say that sometimes you may apply this logic model to your program, and you may come up with the fact that the program is not necessary.
Exactly.
And that's hard. That's really hard. Really, really hard. But important, because we all know we've got limited resources. And we all know that we need to make progress, because we don't want this generation to face what the last generation, to face what the present generation is facing. And so sometimes this, as a program evaluation tool, you can get to the end of it and say, actually, I'm not even close to addressing a root cause. Not only am I not close to addressing a root cause, but I don't even have any relationships and collaborations that are getting me to a root cause either.
Yeah,
And that's
I
hard.
like the root cause is so powerful. That those two words together are extraordinarily powerful. And I think that they should be a part of the explanation of our grant process.
Right.
Because the changing of that model that that you're talking about, how things have not changed from the 60s to now with poverty. And so now those that are giving out the money are looking at a shift in what they want to see. There still may be those organizations out there that are still looking at it in that old way.
Right.
And by conversations like this, you're helping us all of us move forward.
Yeah.
But sometimes that moving forward in the way of root causes takes that continued reminder of
Right.
what that is and what that looks like.
Right.
So
And-
thank you for the presentation.
Of course, and sometimes, Councilwoman, I think that, we've had a lot of changes in our community in 20 years or 15 years or even 50 years. And part of I think a benefit of a logic model can help us as a tool for continuous improvement, to be able to evaluate over and over and over again and say, I know we did this for 5 years and it worked for 5 years, but things have changed in our community. Our population has changed, or this has changed, or that has changed. Or what we all hope for is that we learned something, and that while this worked, this works better. Or we learned through a relationship with this agency that we don't actually have to do this anymore. We simply make a referral and a connection, and we let the expert here do it, and we continue to do what we're good at, but we don't have to do everything because we've developed relationships with folks. And so maybe this part of our program goes away because we've now relied on this organization that has plenty of capacity to do it and can actually do it better than we can. And so we focus our resources here on maybe what we're better at.
Well, and let me just add one point to that. You're saying how the poverty level still is not changing, right? We're talking about root causes. And my thought is there's a number of things I'm thinking about right now with all the different agencies and you guys being, leading the way in so many ways with articulating this root cause model that old systems are not working, et cetera. So what help can the city possibly give, or what are your ideas on how we kind of have a come to Jesus moment about what we have going on in the city of Topeka with all the agencies, and are we doing our due diligence by figuring out what those root causes are? And then I would take it one step further, because I would take it one step further of, do we really want to know what the root causes are? And what?
Keep going.
No. Preach.
No, but
You're
I mean,
right.
where else to say this but at a public meeting? You
Yeah.
know what I'm saying?
Yeah.
Do we want to know that we're not talking about, in some regards, racial inequities? Do we really want to talk about that until we get a living wage, right? We're going to keep throwing out this money that will help, but we're going to find the cycle stay the same. Do we want to see about the breaking of the family system because they're working so many hours? You know, there are deep systemic root causes, and until we really start addressing those honestly, right? I'm not saying throwing money at, but how can we really expect those root causes to come up to the light of day unless we start saying about what they are, or what our research has shown
Right.
with talking with families and looking where their needs are, where those root causes are. I'm just saying.
You are absolutely right. I had the privilege a couple of weeks ago. Was it 2 weeks ago, Tawny? 2 weeks ago. Thanks to the board at Community Action and Tawny and the leadership staff there, to be able to go to the National Community Action Conference, where we actually talked about, I mean, when you have an organization like Community Action, for example, whose sole purpose is to fight poverty, and you start talking about poverty and root causes in that way, a lot of this stuff is very fresh in my mind. And to your point, sometimes we simply avoid root causes because when we get there, it starts to unmask things about us and about our behaviors as a community, and about how we're complicit in systems that we may not be individually responsible for, but we're individually responsible for our participation in them, and we may not even know about them. And so sometimes when we get to issues like this, when we're talking about folks with poverty, we have issues, for example, even measuring the poverty level, right? Because it was based on a formula in the 1960s that really doesn't fit anymore for families. And then it's likely probably more like 40% of our folks are just on the edge in our community.
Yes.
Maybe not 23% or something like that. The other thing I think we get to when we're talking about this is, you're absolutely right when you mention a living wage. We have people in our community that cannot afford to live here. And that's just the bottom line. They cannot afford to live in Topeka, Kansas. And they work. And they work multiple jobs, and they still can't afford to live in Topeka, Kansas. So if we're talking about upstream, while we have programs that are hugely important midstream and downstream, somebody should be talking about why in the world people don't have enough money to live in Topeka, Kansas in 2021.
Right.
Those are, and it doesn't mean that everything else halts and you stop every program and you go, but it means that we develop those relationships and those collaborations in ways that we still carry down the downstream work, we still carry out the midstream work, but we're talking upstream very seriously and honestly about how we have up to 40% of the population in Topeka that can't afford to live here without government supports. Why is that? And those are questions, when we ask them, they get uncomfortable because nobody wants to talk about money when you get to the household level. And we have all these stigmas about why people are poor. And we have all of these presuppositions about choices people make, and we oftentimes put burdens on populations that we don't put on other populations. And sometimes we make assumptions about things rather than looking at what the data actually tells us, for example. And so, yeah, I think crucially important. And honestly, I mean, I've lived in Topeka 18 years. I mean, I haven't been in conversations quite like I have been for the last 6 at United Way, but it seems like there's conversations in this community that are getting us closer. And I would say when you talk about the city and how can the city be a part of it, the city did a great job moving toward outcomes. That's huge. It's hugely important, and constantly looking at the application and the reviews and and the review rubric and making sure that we're asking the right questions of programs to make sure that we're getting to those outcomes. So I think the city's done a lot to get there. I think we all have more work to be done, but I think we're getting there.
And I would just say that in any capacity that I can help,
Sure.
especially to move the dialogue forward
Sure.
with any type of conference or summit,
Sure.
I'm totally down, because I have no illusions that the city is a miracle worker.
Sure.
I mean, none of us are miracle workers, but what we can do, I think is very important for this city, is social service agencies to move outside of their silos and start communicating better. It's just like when doctors, they went to the computer model for sharing all their records, and now St. Francis, when I go to Stormont Vale, they can share records, et cetera, et cetera. What I'm talking about is more communication needs to happen. The territoriality that occurs within Topeka, I'm sure, is like other municipalities, but it needs to stop because it does not serve those that we are meant to serve. And we have to have these hard, uncomfortable dialogues. Otherwise, we stay in this meeting capacity in a redundant, stagnant fashion to some
Right.
extent. And I don't think at heart anybody involved as an elected official or a social service agency really in their heart of hearts would want that
Sure.
for the betterment of Topeka.
And my guess is my colleagues behind me would say sometimes funders pit us against each other and make us territorial because of the way we allocate money. And that's something that at United Way we need to take a look at, and we need to take a look at the city and others, because sometimes we're complicit in a system where we force people to be siloed because we said we wanted them to just do this and for them to just do that. And we put such stringent grant requirements on it that they don't have the capacity as an organization to work beyond those silos. So sometimes we have to take a look at those things too. And I don't have that figured out. I don't even have that even close to figured out. It's on my radar, and we're having those conversations. But those are some ways that funders, cities, United Way, foundations, and others can take a look at that as well.
Thank you, Brent, for your honesty.
Thank you for all of this, and I appreciate the feedback. The city did go to an outcomes-based some time ago, and so we've got a process here. We've had some comments. Did you have a question?
I want
Or comment?
to comment, if I can.
Please, just for everybody, get to the mic.
My name is Kay Gray, and I'm here representing Pappins. I'm the president on the board, and Debbie Lake, who is the director there, she was not able to be here. And the comment about verbiage is so important because the application, the verbiage on it does not really explain what is wanted. And today has helped a lot. I've taken a lot of notes. Debbie will look at all this. I came with 5 areas on our score sheet that we did not understand, and I really think we're doing the work, we're having the outcomes, we are not able to, and she's done this application for 25 years with the city. But as you said, things are changing what it is you want, but the verbiage does not reflect sometimes what we really need to be presenting. So I think it would be great if Debbie and I could talk to somebody at United Way and go over these 5 questions and get an explanation, plus training and refining the verbiage, I think is very important for everybody.
Well, thank you for that. If you all did not take advantage of consulting with United Way before, that's certainly something you can do now, and certainly in the next cycle.
She did. As she was working on this, she kept asking questions.
Okay.
But evidently, not the right questions, or not exactly understanding what was wanted or needed. So we'd appreciate more help.
And then, but by this presentation, did it not make it much clearer?
Yes.
Yes.
It did, but there's still some
Questions.
I read over all this, and I don't want to go through it now, but there's still some things that I still don't understand from the score sheet but this helped a lot.
Thank
Okay.
you so much, and your comments are good for, I think we can wrap up today rather than needing to go all the way till noon, but the idea for doing this special session was to make sure, since we do use an outcomes model and have for some time, and there have been questions about it, to make sure that our committee members, especially as we're transitioning to United Way as well, and our key staff all understand a needs-based outcomes model, so that it's really pretty universal. I use it in city stuff too, as far as that goes. Why are we doing this? And if there's no good reason, maybe we don't need to. It's so simple. But where we are now as a committee, this hopefully gives some framework for you all with one another, with United Way, who's supporting our process, and with us. The homework that we all have, most of you are familiar with our setup, but once the allocation cycle is over, then we go into a process in the fall as a committee of re-looking at our application forms and our priorities to set the state, to make a recommendation to the city council for what we should do next year. And your input is welcome. So everybody's homework is to look at the forms again, to think about that outcomes model if there are questions, and also to look at what our process was, because we will be eager to have your feedback on ways we could improve the process for next year. And I'm not sure I've got our meeting dates in my head, but we're already scheduled for meetings in October and November to go over this process. You all will be invited. I got a message from Liz, who is off today but is watching apparently, and the PowerPoint is already posted on the city's website with our social service grant committee, and I think will be emailed out to all of you shortly if it's not already in your boxes. So sorry you didn't have it in advance, or that we didn't make more copies. I'm not sure how that planning went, but usually we try and do that. And I penciled in our discussion some thoughts about other things that we might want to change in the scoring. We've talked about budget scoring before, budget sources, and how critical our particular source is. That's been a tough one to consider scoring, so it hasn't been. But when Brett went through the model about your choices of what the inputs are, are we optimizing that as well? Maybe something we consider. The duplication is something you all already answer out of the discussion today. Maybe there's and collaboration as well is a question that you answer and are scored on. We may want to look at how those actual score ratings are done. Those have not been things we've talked about much in the past, but and the unnecessary expenses, we again have not really rated people's budgets, but Brett made a really good point that the ideal place to use the outcomes model is in your own program, self-evaluation and planning, so that if there's something you're doing that's not, even though it's fun, I think about my days at HCCI when we did a newsletter. We used to send a newsletter out to all the public housing tenants, and later did one citywide, and it was good. We worked hard on it. It was, Tawny's laughing because she remembers, she was around back then. It was great, and our funders loved it. So they were cool with it. That was before the days of outcomes. Just, did you do that newsletter? How many did you get out? Yeah, we did it. And we used to joke a little around the office about birdcage liners. We wondered kind of if anybody really read it. And finally we decided that to get information out to the community, we were better off to make a goal of getting something in the public media once a month, having a newsworthy item that got out to 100,000 people instead of the 1,000 people that our newsletter was getting to. And we dropped it. And it was, like Brad said, that was hard to do because it was popular, but it was a lot of work. And we always had people come over from one of the neighboring housing projects, and I think they were involved in some organization, severe and persistent mental health folks, and they would come and they'd help us do the newsletter and get the bulk mail ready and everything, and we loved doing that. But it wasn't helping significantly to accomplish our goals. And so those are hard to do, and we've not really evaluated those. And it could be that the city would decide not to go that deep also. I mean, funders are different about that, but this presentation has raised some good issues. And the root cause issues, whether we would be looking at whether people are really going after those, or if you're doing responding, if that's good enough, that kind of thing.
We should.
Something,
Look at the root
so those are likely discussion points, and any input from you all would be welcome, very welcome, in advance or at those meetings. You know that we're open to having the input at the meetings, so. Anything else that, Brett, that you have, city manager, any comments? Councilwoman Betty Biancola? Anybody else from the viewers on the Zoom? You never know where to look. I guess the camera's right there. Figure it out. All right, well, with that, we are adjourned. Thank you all. Oh, I have a sticker right here. The next meeting is October the 8th at 10 a.m. It was a sticker I had on my note.
October 8th?
Yep.
Does it have one for November?
And November and December's are also on the city public calendar, all three.
Not for these yet, no, because they just got finalized.
We have meetings until December? Wow, okay.
Well, it often takes 3 to